Hello, my name is Dr. Martin Schnell, and I'm going to be discussing skin grafting. So, the most common skin graft is when someone has a wound that's difficult to close and closes it with skin taken from another part of the body. There's two types, full thickness and split thickness. Full thickness is where they take a full thickness layer of skin. Split thickness, they can actually take a thinner layer, and that's the one that's used more commonly. And it's often used in skin cancers and things of that sort to close a wound. We do a procedure that's called grafting, but is not true skin grafting. We use products called skin substitutes, which come from living tissue but are acellular. For example, the one we use comes from mammalian placenta. There are some that come from bovine intestine, some that come from swine bladder. They all share something in common. They have a part of the tissue called the basement membrane included. And these basement membrane or skin substitute products have remarkable healing capacity, and they're very heavy in growth hormones and proteins that promote healing, and they actually heal using stem cells, and they use the person's stem cells, not stem cells that come from the graft. So these basement membrane products have the proteins that actually attract the patient's stem cells to the wounds. And those stem cells will then differentiate or become whatever the tissue is that needs to be healing. So traditionally we use these in wounds that go down to the muscle layer. And when we use these products, the wound will heal all the way to the surface with muscle, as opposed to the traditional way of healing, which is by scar tissue. So it makes a much more physiologic repair of the wound, and it's much faster.